American Academy of Pediatrics is putting its guidance under the microscope to eliminate race-based medicine.
Yeah, for years, pediatricians have followed what are now believed to be flawed guidelines, creating health disparities in Black and brown communities. Scrutinizing treatment recommendations intensified after George Floyd's death in Minneapolis back in 2020. The AAP released an article on Monday saying, quote, "Race is a historically derived social construct that has no place as a biologic proxy."
Joining us now to discuss this further is Dr. Joseph Wright. He's on the American Academy of Pediatrics Board of Directors and is the Chief Health Equity Officer for the University of Maryland Medical System. Dr. Wright, welcome. Great to have you with us. I think a lot of Americans would be surprised to hear that there was any such thing as race-based medicine at one point. Can you explain where that came from and what were some examples of it and how it created some critical disparities in the way patients are treated?
Certainly, and thank you for having me today. What we're talking about is the inappropriate use of race or ethnicity as a risk modifier or variable in clinical decision-making. And its roots are deeply embedded in all parts of medicine and are part of our broader history. So I am often asked, where did this come from? And I refer to historical examples of where race has been utilized as a biologic proxy, which is incorrect. And what we're talking about today is unwinding that and dismantling all remnants of race-based medicine.
Dr. Wright, we're talking about eliminating race-based medicine. What does that process even look like? Where do doctors begin?
Well, we have to begin first with honestly reconciling everywhere in the practice of medicine where we have race, again, inappropriately embedded as a social construct in clinical decision-making. And so it starts with a reckoning. It starts with a reckoning for our profession to, first of all, recognize that this exists. Second of all, to understand the history of how we got here, and then moving forward to be committed in a very concerted and rigorous way to not only remove race and ethnicity where it has been inappropriately inserted, but to have a consciousness about the impact of race on the differential lived experiences of the patients that we care for.
Doctor, can you give us some specific examples of where this may have played into healthcare so that, patients and their families can identify it if this happens to them during the course of their healthcare and help in the process of eliminating this sort of race-based medicine?
Well, first of all, let me just state that we want the public and patients to be aware. This is very important in terms of ensuring public trust. So perhaps the most widely known and most advanced in terms of removing the race-based calculation is for patients with chronic kidney disease. And for decades, that calculation has been based on a flawed assumption of differential skeletal muscle mass between Black patients and white patients. And Black patients were therefore inappropriately and disadvantaged in terms of access to advanced kidney care and in some cases kidney transplantation based on this flawed assumption and based on this calculus that somehow this difference in skeletal muscle mass was a real thing. And so that is one example. Another example that we cited in the paper is for the vaginal birth after a cesarean section for women of childbearing age who may have previously had a cesarean section. And that calculator has been for decades also included a race and ethnicity modifier that needs to be removed. And in fact, health systems across the country are removing that modifier.
Well, Dr. Joseph Wright, thank you so much for sharing all of this insightful information with us. We appreciate it.
Thank you.